Jean Miigwech to Jean Goodsky for doing our invocation this morning. Bonjour Anin, Minugajeb. Welcome everybody to the Tribal Council meeting today. With that, we'll call the meeting to order. Roll call, please.
Kathy Chambers.
Here.
David Wilson. Here. Travis Morrison.
Here.
Shane Tripp.
Here.
Peter Bowling.
Here.
Okay, next we have approval of the agenda. Do we have any additions or deletions to the agenda?
We have two items to add. First is Pam Hughes and Melissa Walls for the grant application, and Dan Millbridge in regards to dental.
Where do you want those, Randy?
Probably at the end.
Okay.
Will that be after George Strong presents or after you
Yeah.
guys?
After George.
Okay.
Okay, any other additions or deletions? If not, no? If not, I'll call for a motion to approve the agenda with those additions. Moved by Shane, is there a second?
Yep.
Second by Chief, all in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Next, we have the meeting minutes from April 1st, 2020 at Nett Lake. There's no questions or comments on the minutes. Do we have a motion to approve the April 1st, 2020 meeting minutes in Nett Lake?
Yep.
Made by Chief, is there a second?
Second.
Seconded by David, all in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Next, we have the consent agenda. Approved to open up travel to International Falls due to the closing of the Canadian border. Adopted Resolution 84-2020 Bois Forte COVID-19 shelter in place. Adopted Resolution 85-2020 suspending per cap garnishment collection for the year 2020. Approved closing the Head Start and Boys and Girls Club in Nett Lake and Vermilion starting April 8, 2020. Approved a $1,000 donation to the KBFT Benner Show for his contests. Approved the new policy for the ambulance service on-call 24 hours paid time. Approved a request from Randy Long to sole source an Everbridge notification system in the amount of $6,705. Approved a request from Randy Long to sole source for an Avast Antivirus 2-year subscription in the amount of $5,830. Approved a request from Randy Long to sole source contract from Libe1iy Pharmacy Systems in the amount of $29,484. The costs include the transition from McKesson Pharmacy Systems to Libe1iy Pharmacy Systems, which took them over. Approved adding language to the 2020 netting code and emergency declaration for the 2020 netting season only. A band member who can use their 1854 authority ID or B, Bois Forte Tribal ID as their official netting permit. They must keep that ID on their person as required in the original code. Approve suspending the June powwows. They can be scheduled at a later date. Approve the COVID-19 expanded FMLA and COVID-19 emergency sick leave policies for the Bois Forte Enterprises. Approve the request from Nikki Irving to sole source the purchase of 7,000 masks in the amount of $750 each for a total of $10,500 from the EMS Association.
I believe that's supposed to be $1.50.
Oh, $1.50? Okay, sorry. Thank you. $1.50 each for a total of $10,500. Should have did my math. Approve the indirect cost rate for 22.40% for FY 2020. Approve the COVID-19 expanded FMLA and COVID-19 emergency sick leave policies for the Bois Forte tribal government. Approved to add section 623 unexpected and extraordinary leave to employee policy effective March 16th, 2020. Approved changing the application date for the sales tax rebate for band member owned business from May 1st to August 1st because the income tax deadlines have been changed due to COVID. Approved a request from Erica Cody to sole source COVID-19 testing supplies from McKesson and Amazon in the amount of $7,774.98. Adopted Resolution 86-2020 New Moon Operating Subsidy Amendment. Adopted Resolution 87-2020 Submission of a grant request to IRRB for engineering services for a water control structure feasibility evaluation for the Nett Lake Dam. Adopted Resolution 88-2020 HRSA, HRSA Rural Community Opioid Response Grant. Long-term homelessness supportive services subcontractor grant agreement. Approve the request from Pam Hughes to sole source 10 iPads from the Apple Store for government in the amount of $9,260 to be used by youth that do not have access to computers for distance learning. And next we have Wendy Thompson. Oh, wait, no. Do we have a motion to approve the consent agenda? My apologies. That was a long consent agenda.
I just have some of the
Sure.
statements and also some questions regarding some of these. My first one is regarding the third one, the adopting resolution number 85-2020, suspending per capita garnishments / collections for the year 2020. I would just like to point out that I was against this at first. I'll read my email dated 3/26/2020. The way the resolution reads regarding the per capita payments is that the accounting department / tribal court will still take a band member's per capita check. All of our band members are having financial hardships due to the coronavirus. We need to be fair and equal across the board. And we did get this clarified, and I did end up supporting it because it was changed so that the band members that own court fines and stuff like that will
Yep.
still be able to get their per capita payments. I'd just like to point that out. Yeah, on the second page, it says approve the request from Randy Long to sole source contract from Libe1iy Pharmacy Systems in the amount of $29,004. The cost includes the transition from McKesson Pharmacy Systems to Libe1iy Pharmacy Systems, which took them over. To me, that doesn't make sense. It's like if our casino purchased another casino, and then we're going to have the customers pay for their membership cards when they already have the membership before. I just like to point that out. It doesn't make sense to me.
Do you want clarification on that?
Yes.
Randy, can you clarify that?
Libe1iy Pharmacy Systems, well, I guess our original pharmacy systems was outdated. It wouldn't interface with the electronic health record, nor could it provide the reporting functions. McKesson Pharmacy is stopping its pharmacy services, and the Libe1iy Pharmacy System picked it up. The contract was up for pharmacy, so it was either finding another pharmacy systems or migrating into this system, which automatically integrated with our internal systems.
Got it. Thank you. As far as approved suspending the June powwows, maybe we could look at doing some type of small ceremonies for both sectors, Nett Lake and Vermilion. That's just a suggestion. Approve the indirect cost rate of 20.40% for FY 2020. Do we know how many grants will be able to pay for this and how many grants can't pay for this?
Usually, I know Kim is on leave today, but I know usually with the indirect cost rates, they currently have budgeted whatever the rate was prior to that. So basically, and I can't remember what the rate was, do you guys? But what, Dale? It's really close to that rate, so it's already in their budgets. So it's just a
I believe
small,
it actually went down too.
it went down, so it's actually going to be more for the programs.
Well, the point I'm getting at is that there's, because the grants that can't pay for this, the tribe has to basically pick up that cost, and I just want to be able to make sure that we can still do that.
Yeah, we can. It went down actually a little bit.
Okay.
Anytime they budget indirect costs, they always budget it high.
Yeah.
Then on the last one is the adopted resolution for 86-2020 New Moon Operating Subsidy Amendment. I did ask a question, if we did not fulfill the requirement, then all we would do is we would lose the subsidy, correct?
Correct.
Okay.
And that requirement is that we have 85% occupancy in those units. That's the requirement that we have to meet.
Okay, that's all.
Good. Any other questions on the consent agenda? If not, I'll call for a motion to approve.
Move.
Moved by Shane, is there a second?
Yep.
Second by Chief, all in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Wendy? Wendy? Next on our agenda, we have discussion on comments on tribal code. Good morning, Wendy. Welcome.
This, I'm taking this off. You got all of these comments and everything?
Mm-hmm.
Ben said he'll be available by phone if you have any questions.
Now, this is the tribal code that was posted and given for 30 days, and then the public gave comment. And we've incorporated those comments into the code, or some of the
Yep.
comments that were made. Wendy, can you basically say, or let us know that how many comments there were? Do you know how many public comments there were? And
No, I can't.
okay, was there quite a few is what I'm kind of wondering, or,
Yeah.
which is good, because that means people are reading it. Oh my goodness, technology. Did the council have, I know it came out yesterday, the tribal code with the comments?
Yeah, this is just
Oh.
the recommendations with the comments
Okay,
and everything that,
good. And those were all looked at and incorporated in the code or whatever?
yeah.
Okay. And are you okay with the code, and the judge and everybody else has had a opportunity for their input on the code?
Yep.
Okay.
Yes.
And what can happen is, if the tribal code hasn't been updated for years, and it's taken a while, a grant did pay for the, grant funding did pay for the tribal code. So it's really great that we have it updated, and even now, I'm sure as the near future comes, and who knows with this COVID stuff or pandemic issues or public safety issues, we may have to incorporate new additions to the code, but at least we're updated to the point with domestic violence and the sex trafficking and dealing with those issues, so.
Right.
Yep, good. Any comments on the code from the tribal council?
Well, and the public defenders just wanted to make sure that it had to do with the felonies, because felonies have to be sentenced more than a year.
Mm-hmm.
And being that there are felonies now in the new code, according to Swanson, Dravnik, and Tausi, felony can be a year and a day, year and 10 days, but that needs to be considered because of the federal laws.
Mm-hmm.
They're just looking at it from public defender,
From the
from a
public defender
defender's
side?
point of view.
Okay. Any other comments or to say we should approve our tribal code?
Well, I guess that's up to you guys.
Yeah, we should put an effective date on it.
Yeah,
Okay. Do we have a motion to approve the Bois Forte tribal code update effective today? And we will get that on the website. George, do you have a comment? Oh, okay. Sorry. And we will get that posted and up, we'll put it, we will post it publicly, and then we also put it on the website. Do you have a
I
motion?
got a quick question. So
Yes.
now, they're gonna look over all these comments now, and then
They did already.
they did already, okay?
Yep, the comments have already been reviewed, and that's what took kind of so long, because
Yeah.
it was supposed to have been done in December.
Yeah.
But Wendy showed a pack of about almost an inch full of comments.
Yeah.
And so those have already been looked at and incorporated into the code or addressed.
and Ben said, and Ben also, one of these has the red lines to it.
Yes.
With
With the
with it-
changes?
Yeah, with the
Yep.
change, and then he said. with
Without the changes,
And
yep.
with no red lines.
So you can see the changes. With the ones that I read yesterday had the red lines in them, and it showed what was changed in the code. And so that, I thought that was a really good way to do that, so we knew what was being changed rather than giving us the whole code without knowing what was
Yeah,
changed.
that's
Right.
what I was doing yesterday too, was reading those up, and I was making sure they were all
Yeah, it is a lot of reading, but
incorporated
it's
already.
really good.
Scrolling down.
Yeah.
I quit reading, I just started scrolling.
Okay, do we have a motion to approve the Bois Forte Tribal Code effective today, the new tribal code updated?
Yep.
Made by Chief. Is there a second?
Second.
Second by Travis. All in favor signify by saying aye.
Aye.
Opposed? Silent? Motion carried. This is a huge accomplishment for us. It's been years since that code has been updated, and we're very happy to have it done now, and hopefully we can just make more additions as they arise with whatever situations arise. So, good job, Wendy and Ben and everybody involved, the public's comments. I think it's a really great day for us. We're up to date with our tribal code, and it's
What
huge
has
for
to
the
do with
safety of our
panda
community.
whitening too?
What's that, Wen?
What has to do with panda whitening?
Yeah, Panda, what's her, victim services coordinator was really instrumental in making sure that the victim services portion and even the Children's Protection Code, all of that is incorporated in here in the sex trafficking. So a huge thank you to Panda Whiteman and our Human Services Department.
Kath, do you think, add to the motion or make another motion to, do it maybe every year or 2 years or something like that, or what?
What do you guys think? We should review it yearly, maybe, to see if there's any new things that come up? Okay, we'll make a new motion for that. Do we have a motion to review the tribal code on a yearly basis from today forward for any updates or revisions that may need to be done? Just so it's set that it won't get forgotten?
Yep. Good
Okay.
idea.
Do we have a motion to approve a yearly yearly update or review process for the tribal code? Moved by Shane,
Yep.
second by Chief. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Great, great, wonderful.
Thank you.
Good job. George. Way to be on the ball.
Good morning.
Good morning.
Got a couple items there. One's a Native Voice 1 contract for the programming that we provide. Standard for the last 8, 10
Okay.
and it's just a
Is this the billboard that's out?
the billboard. The billboard's a separate one.
Oh, I'm sorry, you're
That's,
doing the native voice one first?
yeah.
Okay,
yeah,
sorry.
Either one.
Okay. And this is just a renewal of the agreement?
Yeah.
Okay, any questions for George? You guys are doing a great job out there.
Yeah, thank you.
I'd like to call for a motion to approve the agreement for Native Voice 1 NV1 station affiliate program renewal.
Yep.
Second.
Made by Chief, second by Shane. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried.
And thank you guys for
Thank
supporting
you,
KBFT.
Mm-hmm. Wait, now you got your billboard.
Yeah, the billboard is basically the same agreement as we had last year. It's a nice placement.
Yeah.
We get comments on it, so,
It's on 53 outside of Cook.
yep,
That's really a nice, nice billboard.
yeah, it is, yeah.
Okay, do we have a motion to approve the billboard lease contract with Red Sunset Land Development in the amount of $1,500, which is in your budget?
Yep.
Okay. Moved by Shane. Is there a second?
Second?
Second by Travis. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried.
All right,
Great job,
thanks,
guys.
Yep, thank you.
Next, we have Pam Hughes and Melissa Walls. Good morning. Come on, stand right up here, girls. Nice purse. Good morning.
Morning.
Bonjour, good morning. This
Bonjour.
is so funny with this mask. I,
I
can't
know.
talk. Can I do this? Maybe I'll go like this just to talk.
You can talk, yeah, go ahead.
This one? This one?
Either, yeah, the little, this
Good
little.
morning. So Pam and I are here this morning. Months ago, before this pandemic came into our lives, we started talking about a project to focus on the opioid epidemic. And I work now, I think everybody knows, at Johns Hopkins, but live in Duluth. And one of my colleagues there developed a toolkit for estimating the count or the number of people who use drugs in rural communities. And so I shared that with Pam and some others around the community. And we think it's a really cool tool that we could implement to really get a better handle on what is the scope of drug use on both sides of the reservation. Mm-hmm. So through Johns Hopkins Opportunity, it's internal funding to do demonstration projects on a variety of topics, including opioid and other drug use. And so we're requesting a resolution to put in an application for that funding and develop a community research team here at Bois Forte and work really closely with health and human service providers, stakeholders, do a lot of community engagement work over a course of 4 years to really get a firm count on drug use. And more importantly to me, to do some what we call qualitative research, so getting stories from people in the community who can share with us what are the needs, what are the gaps in services, where are people being left behind, where can culture work as a form of treatment. We have a lot of data from other studies that culture is really critical to recovery. And we are proposing to do this not just in Bois Forte, but with our colleagues on the Cherokee Nation in Oklahoma, which is, of course, a very, very different context, very different legal system, very different geography, much bigger in size. So we can learn across communities how things are different and similar in different cultures.
Why Melissa and I were even talking about, I think it was, we were at a council meeting and we were sitting and talking, but I was explaining to her when the pharmacist from Red Lake came up
Yes.
and met with us
Yes.
all, and when there was talk about people, were wanting to know how many people were using and stuff on the reservation, well, I kind of was relaying that to Melissa, and anyways, needless to say, she started talking about this research, so.
I think it's a great idea. We're always looking for data specifically to Bois Forte, which will help with future funding, but we're also looking for solutions and ideas for, like you said, the qualitative research, and then also incorporating the Cherokee tribe on the other side with a totally different aspect, different community, different traditions than us. But there's never, ever that I can think of, Pam, and you can correct me, that where we've had Bois Forte specific data related to the drug problem here on the reservation, and that's a huge step for us.
And we haven't. The only data we get is from Danes.
Mm-hmm.
And that's just saying, how many people entered treatment, ages and stuff like that, but nothing like this data that we've had.
I really want to commend Melissa and yourself and your department, and because, first of all, John Hopkins, congratulations on that, Melissa, for accepting that position. It's really nice to have a institution like John Hopkins dealing with tribal issues, and this will help us with grant applications. This will help us with the problem here, number one, and how do we address it, and how do we incorporate the culture and language and whatever it may be. And hearing those stories, I like that, because it comes from that's the way we are. Our stories are all verbal, but there are a lot of good stories here at Bois Forte, and so I think this is just a great opportunity, and I want to say it's a chi-miigwech to you guys. Any other comments, guys?
Yeah, I'm just trying to, skimming through the paperwork here. And I think it's the third page to the last. It says electronic record and signature disclosure. From time to time, Bois Forte Band of Chippewa, we, us, our company, may be required by law to provide you certain written notices of this or disclosures. Now regarding this, has legal reviewed this? Our legal team, our lawyers?
No.
I'm not sure what, because we got,
This has not been, this information has not been sent to our legal. Normally when I do the stuff to the legal is when we have the actual package to send, like once it's wrote and everything, and then send it to.
Okay.
I would like to have legal review it first before we approve it.
yeah.
We're just doing the resolution for the grant application at this point.
But still, I'd still like to have legal
Yeah.
review it
Well,
before we pass the resolution, because we don't know what we're getting into.
Have it marked on there? Jeff did review the resolution.
Jeff
Yeah,
made the
that part he
resolution?
did.
So he reviewed the paper.
So he must have reviewed the
paperwork.
packet.
Or he reviewed the paperwork, or did he just draft the resolution?
We need the resolution.
He
And-
drafted the resolution.
Yep.
He reviewed all the paperwork.
Yeah. I'll read let me read any more questions, Shane? Sorry. Okay, let me read the resolution. Whereas the RTC has previously authorized, let me go before that. Whereas the lawful governing body of the band is the Bois Forte Reservation Tribal Council, or RTC, and it is authorized to undertake activities to promote the health and well-being of members and to enter into agreements with public and private entities. And whereas the RTC has previously authorized participation in health research projects with team members at the Johns Hopkins Center for American Indian Health, including Dr. Melissa Walls, and whereas there is an opportunity for funding from the Johns Hopkins University SCIBAR initiative for the purposes of implementing community-driven research to understand the scope of substance use problems and address inequities by translating research into action. And whereas RTC finds that the band support of a grant application may provide benefit to band members, and now therefore be it resolved that the RTC hereby approves investigators at the Johns Hopkins University in collaboration with community team members and service providers, including Pamela Hughes, to submit a grant application for the purposes of seeking funds to implement community-driven research to understand the scope of substance use problems and address inequities by translating research into action locally. So that's the resolution. And then usually when we do a grant application, the resolution is attached, and I believe there is a process or a form process that goes along with that application to make sure that it goes through accounting and the legal and the departments and the health director. So we do have a process in place to make sure all the I's have been dotted and the T's crossed and everything is kosher. So I think it's a great opportunity.
So once you gather this data on our band members, where's the data going to be kept?
We can keep it securely at our offices in Duluth on a cloud-based electronic encrypted system, or if the community research team, which has happened in the past, would prefer that there's infrastructure here to house data, that's fine as well. What I always write into every grant application is that the data from each community is owned by that community. So Bois Forte would be the owner of the data.
Will be kept where again?
Usually we are asked by community research teams to keep it securely at our offices in Duluth because we have the statistical software to run analyses on it, but it could also be kept here. All of that sort of gets developed with the community research team.
So basically it's our data, and then if somebody wants to access that data or whatever, they would have to get permission from the tribe to do that.
Yep.
Because, with the diabetes one that Melissa works on with
Yes.
Doris, they have that community research team too. And that was kind of our thoughts, right? Is just bringing them together as to oversee this one too.
Okay.
And we don't have any funding yet. It would be probably September, October before we'd hear if we do get funded. And what we've done in the past is come back before council when we would form a research team and say, can we have your approval for this board to be the advisory council for this work, to make those sorts of decisions on behalf of the community, or would you prefer? We always bring the data back in technical report form, get it to the grant writers, get it to tribal council leaders, members, et cetera, et cetera. So.
And that research team is local community members?
Yeah, all local people. Yep, local band members.
Okay. Any other questions for Melissa or Pam on the resolution? Do we have a motion to approve the resolution to support the grant application with Johns Hopkins? Moved by David. Is there a second? Seconded by Chief. All in favor signify by saying aye.
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 Opposed?
Aye.
Huh?
Nope, I approve it, but I'd just like to point out too that ahead of time, it'd be nice to get the information beforehand so that we can read it, not read it during the meeting, so.
Okay. Opposed? Silent? Motion carried. Good. Good job, Miigwech. Thank you.
Thank you, ladies.
Oh, yeah, Dan. Oh, there it is. I couldn't see that yesterday. Good morning, Dan.
Hot off the press stuff.
All right. Oh. Phew. Go ahead, Dan.
So, yesterday Governor Walz lifted some restrictions on dental. And we got this at like 3:45 yesterday, so we kind of whipped up a little plan this morning to get us started.
Good.
See what you guys think. It's a suggested plan to proceed with the next phase of opening dental per Governor Wall's executive order regarding elective care effective May 11th. So this refers to like crowns and bridges, root canals, fillings, and dentures. And these procedures are based on the dentist's discretion, based on whether they believe deterioration will occur in the next 3 months. The discretionary kind of elective stuff.
Okay.
Next is a list of proposed recalls to accommodate this.
Okay.
So I just kind of listed them out. Like me to go through them, I can. The equipment, we want to order some specialized high suction, high volume suction equipment. For the 4 machines, it would be, actually it's 10,200. I got an update since I wrote this up. So
Oh, okay.
so we would have to sole source that, but there's grant funds available. Henry Schein is one of the dental equipment makers that we would get that through. And we will develop an implementation plan for management and treatment of non-emergent and elective dental care. That's one of the requirements. So they did send out kind of like a template, and we can just modify it to meet our needs. As of today, there's nobody in dental on today, so hope to kind of whip something up by the end of the week.
Okay.
Get something drafted, and maybe get our doors Monday,
Okay.
if we can. We just got to work hard to get everything in place.
Mm-hmm.
So there's some recall stuff on here, bringing dentists back and some staff.
Good. So the Board of Dentistry, I'm assuming, because that's what stopped everything before, was the Minnesota Board of Dentistry said no dental procedures unless they're emergencies.
Yeah.
Which a lot of the dentists, of course, in the state and on tribes within reservations are licensed by the Board of Dentistry. But now that Governor Walz announced lifting restrictions on elective surgeries in hospitals and now dental also, I think this is a good plan. The other question I have for you, Dan, as long as you've got the, I agree with the purchase of 4 high-volume suction machines, and I know you only get those from Henry Schein.
Right.
We could also do a motion for a sole source right today, so you don't have to come back with that, because I know that there's issues with dental with regards to drilling and dust and that kind of thing with regards to the COVID-19 issues and whatever, so the more safer we can make it. If you could, I guess I would like to see a copy of the draft plan for the implementation for the non-emergent and elective dental care once it's completed, just so we can get a look and maybe ask any questions we may have at that time. But I think it's a start. It's, you know, we mentioned in our meeting the other day with our emergency response that we're never going to really get back to the way normal was before. And what is our new normal? This is kind of going to be the new normal for a while. And that plan that you're going to come up with for the non-emergent and elective, it's going to be different for quite a while, I think, because of the COVID-19 virus. So we have to start somewhere with getting to the new normal. So I think this is a good idea at this point. So I don't have any other questions. Council, do you have any questions regarding Dan's phase for opening dental after Governor Walz's executive order yesterday? No? Okay, do we have a... Yeah, May 11th, it'll be Monday, right?
Yes, we're hoping to get our plan to soon.
Well,
And dental would have to get drafted by tomorrow
okay.
afternoon.
Joel?
Dan, you have to wait for the suction machines to open or no?
That'll be part of our plan. There might be some procedures we can use without it.
Okay.
So we would, and I forgot to mention, there's about 4 to 6 months of backlog for these types of procedures. So we would go through that whole patient list and start calling people in based on priority and what we can handle based on our suction needs.
Okay.
But yeah, we would try to get that thing ordered ASAP, or the 4 machines.
Yeah, Dan, that's what I was gonna ask you about, you know, the backlog and how you were gonna handle that. And then, is there a couple days that your staff has to come in and kind of get the machine or whatever they have to do to do any cleaning or anything like that, or some kind of a procedure in place
don't know
before
that
they
the
start
total-
seeing patients?
There's probably very little training with the suction machines. We just have to see how they collect if there's filters on them that have to be replaced frequently.
I think there's going to be a lot of happy dental patients out there that have kind of been waiting for procedures and whatever. You know, I commend you and the staff there for, you know, it's kind of hard to sit back and hear of these patients, you know, what they're waiting on their stuff. So even with the elective surgeries on the medical, it's, you know, it's just been really horrendous. I'll just have to say that.
And I'll give a plug for our new dentist, Dr.
Oh, yeah.
Peggy Stepan. She started, and then this hit, the COVID hit, so she really hasn't been exposed to a lot of patients exposed to her, but excited for her.
Thank you. We forgot about that. We did hire a new dentist. It's a female. It's Dr. What's her first name?
Dr.
Peggy Stepan.
Stepan.
And we welcome her on board. She came at a terrible time, but she stepped up and tell her thank you for that.
One thing we might consider in this plan is leaving the dental staff separate for a couple weeks.
Yep.
Like one set at Vermilion and one set at Nett Lake, and begin rotations later.
Yeah. Okay. Any other questions regarding Dan's plan and startup for the dental? Can we have a motion to approve the recall of staff on his list and opening dental per Governor Wall's executive order, May 11th?
Move.
Moved by Travis. Is there a second?
Second.
Second by Dave. All in favor signify by saying aye.
Aye.
Opposed? Silent? Motion carried. Can we do a sole source request for Henry Schein for the purchase of 4 high-volume suction machines, which may total around $10,200?
Move.
Moved by Travis. Is there a second?
Second.
Second by Chief. All in favor signify by saying aye.
Aye.
Opposed? Silent? Motion carried. Good
Thank
luck,
you.
Dan. Thank you.
Can I
Good
get
job.
the clarification on the first motion?
Yes.
Under the billing staff, I have 2 to be determined, because
Yep.
I haven't had a chance to talk to Lynette yet.
Okay.
So we would just add based on what her needs for dental billing is.
Yeah, yeah.
Okay, thank you.
Okay, thank you, Dan.
Thank you.
Is that it? No other business. I'll call for a motion to adjourn.
So we got Randy's and Joe's.
Oh, Randy and Joel, do you have something? Oh,
What about? Yeah.
that's in,
No,
oh, I'm sorry, we have Josh.
this is, yeah.
Yeah, it's like,
I think Ray's outside too.
oh, Ray.
He's in the
He's an
Oh,
executive.
is it?
Thank you, Shane. We would have cut Josh off. Poor Josh, I almost cut you off there, Joshua. Sorry about that. Come on in, sir. Welcome.
Morning.
Morning.
I have a few packets to hand out. I didn't have them before, but I have them now for you to look at. What this is, the top page is
Okay. Yep.
so I've been on the tower ambulance for 5 years. I just recently resigned as the assistant director, but it's called the Tower Area Ambulance Replacement And it's made up of 7 entities, 6 townships, and then Fortune Bay. And they make donations every year towards the purchase of new ambulances. And I've been the assistant director for 3.5 years, and only one time there was a representative from Bois Forte there. Jeff Dam usually does show up for Fortune Bay, but I would like to represent the tribe since our ambulance covers the entire Vermilion Reservation. That's what my request is today.
Okay, so you'd like to be appointed as a Bois Forte representative for the Tower Area Ambulance Service Commission?
Correct. And I would like to do it on a voluntary basis. I'm not requesting any kind of compensation.
Okay. Okay. We have any questions for Josh? I know that Jeff Dam does attend these meetings representing Fortune Bay, but we've never really had a representative specific for the reservation.
Correct.
As a whole, so. Any questions for Josh? Okay, do we have a motion to approve Josh Villebrun to represent Bois Forte Reservation on the Tower Area Ambulance Service Commission as a volunteer? McKesson?
Yep.
Made by Chief. Motion to approve made by Chief. Is there a second? Second by Dave. All in favor signify by saying aye.
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 Opposed? Silent? Motion carried. Thank you, Joshua, for doing that. We will get a letter out, WICO, to the Tower Area Ambulance Service Commission, telling them that Josh would like to be our representative, or has been appointed our representative, to represent the Bois Forte Reservation.
Thank you. And
Thank you.
2 more things I wanted to add.
Go ahead.
One is I would like to meet with all of you to find out exactly what you'd like me to
Okay.
represent
Okay.
at these meetings, especially now that you have some information.
Okay.
And then the second thing I wanted to do was congratulate the staff at the Tribal Court, PD, and Human Services, and thank you for approving the new tribal code. I remember helping out with that a few years ago when I was lieutenant. I didn't know that was on the agenda today, so I got pretty excited sitting out there when I heard it get approved. So,
Well, coming from the law enforcement standpoint, Josh, we know that you served on the BIA as a BIA officer, and we want to thank you for your years of service. But even just hearing you say that today and being here, it was kind of like it was meant to be.
Yes.
And
yes.
so we're very glad about the tribal code, and you coming from an officer perspective, retired officer, can now say, wow, we actually got it accomplished. So.
It was many years in the working.
Yes.
So I really appreciate past that.
Great, thank you, Josh, and thank you for your service here now to represent us on the Tower Ambulance.
Thank you for giving me the
Yeah.
opportunity.
Thank you.
When-
Welcome back. You look great.
When do you think we could meet, actually?
We'll coordinate that with WICO.
Okay.
We'll take a look at your paperwork, and then we'll have her get in touch with you to set up a meeting.
Okay. The next scheduled, they're quarterly meetings.
Okay.
So it's in July.
It's in July, so we'll meet with you prior to that. And we can meet over in Vermilion.
Okay.
Okay?
All right, thank you very much.
Great. Thank you, Josh. Have a great day.
You too.
Meet in
Just
Vermilion.
have one more thing, Kath.
Yeah, go ahead, Dave.
Jean, well, I picked up the McKesson gifts for the spring ceremony,
Okay.
and Jean just asked me about setting a date for next week sometime to have the spring ceremony.
Okay.
So, I don't know, the 14th work, or we have anything set for that, or?
What day is that,
Maybe
Dave?
Next Thursday,
What time?
I suppose probably in the morning. I would
Morning,
think,
yeah. Thursday morning, okay for a spring ceremony? Thursday morning, next Thursday? Okay. Yeah, next Thursday. Okay. Okay, before we adjourn, I'd just like to say that on behalf of the Tribal Council, and you can speak up if you'd like, but we realize these are hard times for everybody with the COVID-19 We're trying to keep you updated as much as we can on our website. We are going to try to get back to the new normal. We hope you're all being safe out there, practicing social distancing and using masks, washing your hands, doing what you can do to keep your family and community safe. It is hard times right now, but we will get through this together. If there's anything we can do, please feel free to call us, email us, use technology however you may, or just even send a letter. But you know, we're willing to help you in any way we can as a tribal council, because we realize there are a lot of needs out there that maybe not be met. And so we just want to say Chi Miigwech to all of you and wish you to be safe and healthy. With that, I'll call. Do you want to say something, Shane?
I'd just like to say, going off what you just said, that yes, it is a hard time, difficult time for all of us. And that if you have any suggestions or comments or whatever, thoughts, please share it with us. 5 heads are better than 3, 7 are better than 5, etc. Thank you.
Yeah, we don't always have the answers, but sometimes it's good to hear other viewpoints and stuff. So I agree with Shane. We need to hear from you. And we do talk with tribal leaders every day, except for on the weekends, and if there was an emergency, I'm sure we would. But it's nice to hear what other tribes are doing also, but we need those comments and suggestions, because that's just what we need. We don't have all the answers. So if any other comments or no, I'd like to call a motion to adjourn. Moved by Shane. Is there a second?
Yep.
Second by Chief. All in favor signify by saying aye.
Aye.
Opposed, silent, motion carried. Gigawabamin, stay safe, everybody.
Miigwech.
Miigwech.